Welcome, friends. We are so pleased to host you here at the Ritz Apartments in the heart of the Adams-Morgan neighborhood. We're grateful especially for this partnership with the Department of Health, DC Department of Health, and working together to make sure that vaccines and other health resources are readily available for all who need them. At Jubilee Housing, our mission is providing access to deeply affordable housing. We do that in neighborhoods that are rich and full of resources, and we offer on-site and nearby programs and services. Today, we operate more than 450 deeply affordable homes in Adams-Morgan, Columbia Heights, and Mount Pleasant, because we know that access to deeply affordable housing is a key step in supporting overall health outcomes and in pursuing prosperity. It also fosters inclusion and equity for our city at large. I want to thank my colleague Maya Gaskins over here, who directs Jubilee's resident services programming. She and her team for establishing this partnership. We want to thank the Bowser administration and DC Health for this partnership and support. So now I am pleased to welcome our Deputy Mayor Wayne Turnage, who also serves as the Director of Health and Healthcare Finance for the district, so that he can bring comments on behalf of the administration. Welcome, Wayne.
Thank you, Jim. Thank you very much. I guess it's still morning? No, it's afternoon. Good afternoon. I would like to, first of all, thank Jim for welcoming us to Jubilee and for hosting the very important vaccination clinic for DC residents. I also want to acknowledge Interim Director Dr. Lewis and the DC Health team for the wonderful population health work that they do every day to meet the needs of DC residents. As we prepare for the holiday season, we are faced with a significant healthcare challenge. The city's acute care hospitals are facing what really is a perfect storm in healthcare, and for three reasons. First, there is a persistent shortage of staff that began developing prior to the pandemic and has bled through the pandemic, especially among nurses. And what this means is that hospital administrators are not able to staff all of the licensed beds in their hospitals, creating a significant reduction in capacity in some of our large and small hospitals. The second problem that we are faced with is that we are entering the winter months, and hospitals are witnessing very sharp increases in the number of persons who need treatment for flu, RSV, which is a respiratory virus that can impact both and be very serious for both our seniors and infants. And now we are beginning to see in the data some upticks in reinfections or infections from COVID. And third, despite the administration's best efforts, far too many of our residents continue to visit the emergency room for what has to be considered low acuity problems, and this spikes the demand for services from staff that are already overworked in hospitals that are already understaffed. Due to these factors, hospital emergency room wait times, if you've been there in the last 3 or 4 months, you probably sat there almost into the next day. They have significantly increased, which also has adversely impacted the drop-off times for our emergency vehicles. And this effectively reduces the number of emergency vehicles that we will have on the street at any given time because it's taking them longer to drop off patients at the hospital. In response to this really challenging problem, the administration will be meeting with the DC Hospital Association on Thursday. Representing the mayor's team will be my office, along with the Department of Health, the Department of Healthcare Finance, my other office, and the Department of Behavioral Health. The goal is to discuss possible policy changes that may require the mayor's review and approval, and it may require legislation should the mayor decide she wants to move something forward to alleviate the problem of hospital crowding and the long wait times for ambulances and emergency rooms. So the question in the immediate is, how can DC residents help with this problem? Actually, the answer is very simple. Please, please, please get your flu shot and your COVID booster vaccine. And this will help keep you and your family safe during the holiday season, and it could certainly reduce the number of people who are making a call on emergency rooms for flu-related symptoms. During the holiday season, we are encouraging all residents to take some significant precautions and look out for your neighbors. And if you get sick, stay home and take care of yourself. In checking on your neighbors, and I hear Jubilee Housing, as I heard this morning, does wellness checks for older residents. That is something that we are very thankful for, Jim, and we appreciate all the efforts that your staff have put in on that a remarkable program. So at this time, I will hand it over to Dr. Lewis to offer some comments about the challenges that we face and how we're moving forward. Thank you, Doctor.
Thank you. Thank you, Deputy Mayor Turnage. And good afternoon. I'm Dr. Sharon Lewis, the Interim Director of D.C. Department of Health. Today, I want to reach out to the community and provide updates on approaches to what some refer to as the triple-demic: COVID, flu, and RSV, which all are categorized as respiratory type of illnesses. Let's start with updates to the COVID-19 virus. The district remains at a low community level as it pertains to our COVID case rates and hospitalizations. Although nationally, there have been a slight uptick in the past couple of weeks, we remain at the low community level. We have less than 5% patient occupancy in hospitals for COVID, 30 new cases within the last week. Most importantly, I must convey the importance for our residents to get up to date and to receive their COVID bivalent booster. That provides protection against severe illness and potential hospitalizations. Also, let's be reminded of what we have learned over the past several months. Practicing good hand hygiene by frequent hand washing and the use of hand sanitizer. Staying home if you're feeling sick, and reach out to your primary care provider if you're feeling sick. You have the option of wearing a mask based on your comfort level when in large groups. DC Health follows the CDC COVID guidance as it pertains to safe practices. Now let's talk about the flu. It is also recommended that our residents receive the flu vaccine. The flu season typically starts in October and lasts until March. It's important that everyone should know that you can take the COVID booster and the flu vaccine at the same time. To date, 170,000 of our DC residents have received this year's influenza vaccine, and we hope that more will receive the flu vaccine as we continue into the winter season. Visit a DC Health COVID center where you can walk in and get both vaccines at the same time. So once again, let me reiterate, stay home if you're not feeling well, and of course, cover your mouth when sneezing or coughing if you become symptomatic. And then lastly, let's talk about RSV, that virus. There have been heightened awareness of RSV, which is a respiratory virus that presents with cold-like symptoms. It is not a new virus. RSV presents as a cold with the typical symptoms that can range from nasal congestion or runny nose, cough, fever, and wheezing, for example. In children, it can be concerning depending on the age, such as premature infants and those with chronic lung diseases or suppressed immune systems. Once again, contact your primary care provider for treatment. Finally, please visit DC Health social media on Thursday, December the 15th, as we discuss more about RSV. There you will see Dr. Farley, our Senior Deputy Director of Community Health Administration, Dr. Mangala, our State Epidemiologist, and Dr. Summers, our Interim Senior Science Officer. Share important information on the RSV, so please join us in our social media platform. And now I would like to turn it over to Deputy Mayor Turnage. Jointly, we can respond to any questions. And most importantly, I would like to thank Jubilee Housing for their having us today. So thank you. I think I got a gentle push. Yes. Any questions?
Talking about following CDC recommendations, I know in places like New York and LA have been asked to put masks back on. What's the likelihood of another indoor mask mandate in DC? Obviously, the COVID levels are low, but that flu is the highest in the country.
Yeah, so DC Health is not recommending to mandate mask wearing. We do follow the CDC guidance, and I believe that if you were to review that, it makes reference to when there is high community levels, then they are recommending for persons to wear masks. Of course, it's left up to any individual and their comfort level. If they're in a group type setting, and if they feel more comfortable wearing a mask, they can feel free to do so.
And then what is the current status of hospitals in our area? I know with this triple-demic, a lot of them have been seeing super long wait times and full capacity. What are you seeing, and is there anything that the district is doing to help alleviate these concerns?
Yes, we've had frequent communications with our acute care hospitals, and as Deputy Mayor Turnage, there will be a meeting that will be occurring on Thursday to further discuss what is happening in our hospitals. I will say about a month ago, our children's hospital was at major capacity in the emergency room. They're licensed for 325 beds. Right now, there are around 300 beds, so there is place for inpatient need if that were to arise for our pediatric patients. They're beginning to see less numbers of RSV, but yes, they are seeing flu. And with that, those that require hospitalizations, we are encourage them to, of course, be inpatients within the hospital, but if not, to be able to be managed under the care of their primary care provider in the home setting.
Hi, Colleen Grablick with DC Assistant WAMU. Is there any consideration to instituting a public health emergency or a state of emergency in DC to handle the filled hospitals and yeah?
So at this time, there is no discussion to implement a public health emergency as it pertains to our acute care hospitals or what is occurring as far as any of the numbers that we are seeing with any of the 3 respiratory viruses. However, we do maintain close communication with our hospitals and to address any supports or needs that they may have.
And for this meeting on Thursday, can you discuss some of the possible, you mentioned policy options or legislation that could come from the mayor?
So at this time, we are going to come together and just have a group discussion about what we're actually seeing within our acute care hospitals as it pertains to numbers, not only those that are presenting to the emergency room, but also any patients that are in need of discharge and placement issues that may arise.
Hi there. Excuse me, Scott Gelman with WTOP.
Hi,
just 2 quick questions. The first being, looking at the staffing situation, is there anything that could be done either policy-wise or otherwise to incentivize recruitment of nurses or any other staff that could help out in DC area hospitals?
Mm-hmm. So I will say that I think that you're fully aware that the healthcare worker crisis is happening all over. Here in the District of Columbia, as far as licensing, we have tried to extend all supports that we can to quickly get individuals licensed or to provide them with a temporary measure such that they can be employed and working within our hospitals. With that, I'm fully aware that some of our hospitals have had to resort to contract services to continue to support. And once again, we will continue to be in close communication with them if we reach a critical concern as it pertains to staffing and supporting of our inpatients within our hospitals.
And then I just also wanted to ask, I know we're talking about flu and RSV and COVID vaccines here. On Friday, there's a looming deadline for some DC public school students to be caught up to date on their routine other vaccinations. Just wondering what, if any, increase or if there's been any change in the level of rise of other illnesses as a result of perhaps some students not being caught up on those vaccines.
But of course, I would want the Chancellor to address the No Shots, No Schools and what they're doing with that. What I can say for DC Health, that we are supportive of our DC public schools and the charter schools. We have been supportive throughout since the summer in providing clinic affiliations such that the students can go and get any of the school immunizations that are needed. So we will continue in that vein.
And has there been any rise in any illnesses that there are available vaccines for in DC at this point?
I am not aware of any rise of any issues. Thank you. Okay. Thank you all very much. Thank you.